A rural African woman has two distinct realities as she gets the news that she's pregnant. One, the fate and the joy of the baby in her womb, and of course, that of paucity of fund and a lack of better healthcare to see to fruition of that baby. In all of this, we'll be looking at what this is about as we talk about whether her life is at risk, whether the baby's life is at risk, or whether some country somewhere is truly bothered about whether she lives or not. Welcome to VSA. I'm Sulaiman. Two words, global gag. Now, officially known as the Mexico City policy, was first introduced in 1984 by former US President Ronald Reagan. It prohibits the United States from funding foreign non-governmental organizations who provide legal abortions, services, or referrals. It also bars advocacy for reforms to abortion laws. It, however, allows access to abortion in cases of rape, incest, and when a woman's life is at risk. It is a silencing and chilling effect on women's rights to their health. The global gag is seen to also affect family planning on the continent as it restricts funding for the procurement of contraceptives for rural and even urban women. It endangers the health of Africa's poorest and most vulnerable women. And of course, that's our focus today. Now, joining me to unpack the global gag today are Tambudzai Gonese. She's a program lawyer at the South African Litigation Center, and Immaculate Oliech from Kenya. She's a program coordinator at Network for Adolescent and Youth of Africa. Ladies, welcome to VSA. Looking at this issue, the impact of global gag rule and what we can make of it is very important that we start looking at that. Now, let me start with you, Immaculate, in Nairobi, Kenya. What's the impact of the global gag rule and what makes it such a dangerous rule?
Thank you so much. I think the global gag rule came at a time when it was not expected, because if we look at when Donald Trump came in, he came in with a lot of expansion when it comes to the global gag rule. And one of the things that he came in with was ensuring that it was attached to the PEPFAR funding. And when it was attached to the PEPFAR funding, as a country, we were able to see that the devastating effect of that. Number one of the most affecting or one of the most worrying thing was that as a country, most organizations who were receiving money from US aid and also were engaging in issues of provision of abortion care services, advocacy on abortion, provision of information, were greatly affected, in that you had to choose between, do you remain with the funding, for example, from the US aid, or are you going to go in with the issue of continuity in advocacy of issues of abortion? So if you were to choose in going for the US aid funding, then it means that you are losing other things. For example, you had to change in your programming. You had to reduce the workload that you're doing, sending in employees back at home. You had to reduce the amount of work that you do in the community. Remember, issues of sexual reproductive health are integrated. So you're integrating provision of abortion care information services, advocacy with provision of family planning services. You are integrating it with issues of immunization. And if the funding was cut, then that means even provision of information on issues of family planning were greatly affected. We saw healthcare workers who are working for the NGOs going back at home. We saw issues of teenage pregnancy coming on the rise because there was no one to provide comprehensive information when it comes to issues of teenage pregnancy. And of course, organizations that were being funded with such amounts of money, we saw them losing out because they had to put and send their employees back at home, which is a devastating effect. For example, there are some organizations that had to completely even do away with their outreaches program. That means the community at the deepest end were not able to access information because some of those services were integrated. And if you're already gagged, you cannot provide certain services, then that means your level of effort is again reduced.
Now, let me bring Tambudzai here. Tam, you see, listening to Immaculate, what really comes to mind is the rural woman on the continent, which is really badly hit by this rule. Tell us how it's been like for your network and team going through this.
Well, it's been quite a big issue for marginalized women, especially the rural women. For example, you find that a lot of clinics that have provided reproductive health care for women have done so through provision of primary health care. And what the Global Gag Rule did was to make it difficult for organizations to be able to offer reproductive health care as well as offer the primary health care that they had integrated into these services. So what would happen is it's either you accept the funding, and if you accept the funding, then it means you now have to cut on your programming. And we know that reproductive health care and abortion are more or less the same thing. But then you then had to have an artificial split, which is really not possible. So ultimately, at the end of the day, it basically meant stopping reproductive health care completely. And on the other hand, if you decided not to take the funding, we all know that the US government is the biggest funder for healthcare. So you would basically be committing suicide, if so to speak. So ultimately, at the end of the day, refuse the funding. Refusing the funding either means that the organization has to shut down or cut on programming. So at the end of the day, it was the same thing. If you had funding, you would only now be able to focus on core business. And primary healthcare was one of the expansions that organizations had actually managed to do. And when rural women went, for example, to get maternal healthcare, they would also be able to get advice on contraceptives. And the Global Gag Rule makes it very difficult to give comprehensive advice, because now you need to know exactly what you're saying and what you're not saying and how it's going to be interpreted. Are you going to be accused of providing counseling on abortion? So ultimately, there is this chilling effect that the Global Gag Rule had, that ultimately even organizations that did not cross the line were so afraid to cross the line that they would over-implement. So at the end of the day, rural women, adolescent girls were the ones that lost more in this.
It's really sad. And now you just painted a very gloomy picture. Adolescents as well as very young girls on the continent were at the end of this, they bear the brunt of this whole rule. Immaculate, in Kenya, for instance, take us through how this is going, especially I'd like to have a sense of how it has affected what your group and of course our primary health care in Kenya, more so maternal health, knowing full well that we have seen a lot of teenage, pregnancy on the continent and even other parts of the world. Did this mean that, you recorded more I hate to use the word, more death because of this rule?
I think our situation as a country, the first effect was felt by the partners who are working on issues of, for example, my organization is dealing with issues of advocacy. And for the first time when we were working in an alliance or networks of partners championing for issues of sexual reproductive health. And number one priority was ensuring that there is access to financial resources towards provision of comprehensive abortion care services. However, when the global gag rule came in place, we were able to see some partners pulling out from the network. So we had to deal in an environment where you have to ensure that your partner organization is very safe so that they don't lose their other funding. So as an organization who is dealing with issues of advocacy, we had to be very careful. Who are you engaging? Who are you bringing on board? And if we were working with those other partners, one of the priority key issues that we're able to provide to us is that we will provide with you the data, we will give you the information that you want, but when you are in the front line, ensure that you don't mention the name of our organization that we are helping you champion for this cause. So it affected a network. It affected really the alliances that are working towards issues of ensuring access to comprehensive abortion services. And when we are talking about this, a lot of people believe that the gag rule was all about abortion. But for us, we felt that it was beyond just abortion, because abortion care services are integrated within the sexual reproductive health care services. So with the gag rule, it limited the level of how we operate as a network. And then number two, it really affected us as a country, because as I've mentioned, that these services are integrated. If your resources are taken away because as an organization you're dealing with issues of provision of comprehensive abortion care information services, you're dealing with advocacy in the other sense, then what are you left to do? The way you provide information to the community, you have to limit it. For example, organizations who are doing outreach services, and these outreach services were integrated. If you're gagged, then that means you have to stop some of your outreaches. That means the local community that you are reaching are not going to be able to access the information. They're not going to be able to access, for example, counseling on issues of HIV and AIDS. They're not going to be able to access, for example, family planning methods, because your finances have already been taken away. Or if you're receiving the finances, then you can't do much as expected, as the way you are expected to do. So at the end of the day, communities were suffering. If you're in an area that is hard to reach, then you have to ensure that you walk to the farthest health facility, which is government supported. But the question is, if you walk to that farthest end facility, are you able to access all the services that were being provided with these partners? The answer is no. Reason being, the chunk of the work was taken by the different partner organizations. So as a country, we felt the heat. The heat was, of course, there, and it's something that it will take us, even if the ban has been lifted, it will take us a long process to be able to change the situation. For instance, the issue of, currently as a country, we are facing the issue of high teenage pregnancy. Why? Because some organizations who are talking about issues of comprehensive sexuality education were not able to access this funding. So what are young people left with? What are our adolescents left with? Not to access the required information that is needed. And as you remember, as a country, we hosted the conference on the 25 plus on the ICPD. And one of the issues that we faced as a country was anti-choice coming into place. I think it was one of the conference that was heated with a lot of people who are campaigning against the conference, and they were talking about this category of people are promoting abortion. So as a country, we really felt it, and as a result, as much as we expected different outcomes, but people were outside there campaigning issues of dealing with family planning, issues of dealing with contraception, as their thinking is gag rule is all about abortion.
I'm happy you've been able to make this clear, because for some, they thought that the gag rule is strictly or simply about abortion. And again, what comes to mind here, especially for Africa, is the issue of morality. Tambudzai, listening to Immaculate, one thing that you can pick from it is that there was the domino effect of this rule, caused by this rule, because this rule is there. It affected other, NGOs that were actually doing something not directly related, but they were scared to the extent that there wasn't any kind of synergy or collaboration with other NGOs. Speak to us pretty much more on this and how it's been going for you in South Africa.
Well, we have seen quite a bit of this within the Southern Africa region as a whole, not just in South Africa. And so you find that it's in the nature of the global gag rule itself not being easy to understand and not being very clear in terms of implementation. So the easiest way is to just gag yourself, to over-implement. And over-implementation then meant that even association with other, organizations that work on youth issues will not link up with organizations that deal with comprehensive sexuality education, but we know that that is one big issue that needs to be dealt with as far as adolescents are concerned. And so there was a curious situation where one organization I won't name had an American headquartered branch and one that wasn't. But because the one that was headquartered in America couldn't be gagged because it was a US organization, their sister organization in outside the US could be. They were one organization, but they couldn't do the same projects. They could not discuss SRHR. And imagine that is fragmentation within one organization. What of other organizations? So, for example, in March, I think, of 2019, there was what was called the Pompeo expansion, where ultimately funding, the global gag rule is really about restrictions on your own funding if you are a recipient of US government funding. But traditionally, this wouldn't have affected third parties like the Global Fund for HIV or other funders like the Swedish government. But however, that expansion basically said, if you are a recipient of US government funding, you cannot subgrant an organization that works on abortion. Now, it doesn't matter where the money that you're subgranting them comes from and what it is for. So even if you were to subgrant them for education, as long as they are an organization that is known to advocate for abortion, then you would have fallen foul of the global gag rule. So that was also difficult to understand in terms of implementation. And at this present moment, it's very difficult to see how, the unraveling is going to happen because things went very bad. And for us, we work primarily on law reform through strategic litigation, research, that kind of mix. So we have had problems, say, for example, in Malawi, we were working with organizations dealing with the problem of unsafe abortion. And one of the issues is that, the law on abortion in Malawi is not comprehensive. In fact, there's no law on abortion in Malawi. So there is need for law reform. But who is able to undertake that law reform when there are pitfalls everywhere? And for us, we wanted to support a case, but getting lawyers or organizations that were brave enough to come up and take up that case was very difficult because of the global gag rule. So it actually goes through all sorts of different areas, not just abortion.
Okay, we'll take a moment. When we come back, we'll talk pretty much more with Immaculate on how NGOs are faring. And Tambudzai will come to you and explore some case studies that you have worked on and see how some are going and if there is light at the end of the tunnel. That's when we return. Well, welcome back. A whole lot happening about the global gag rule. And of course, in 2017, a few months after his inauguration as president of the United States, Donald Trump enforced the global gag and even expanded it to cover HIV and AIDS and infections like tuberculosis. The Mexico City policy, or the global gag, was extended to nations and NGOs who don't get aid from the United States. This meant that organizations, donors, or national governments who support abortion will be governed by a U.S. policy. Other than the $600 million it denied organizations in women's health support, the global gag, through its expansion under Trump, denied African and global women's health NGOs a share in the 8.8 billion naira funds for health support. Now, this has increased Africa's maternal mortality, which is currently 2/3 of the world's total. Now, more than 600,000 newborns die yearly in Africa, and there are just as many stillbirths. All of these because there is little to no funds to help cater for these vulnerable women. Now, the global gag, in its attempt to reduce or stop abortion, has increased abortion, as more women now get rid of pregnancies using crude methods, which leaves them with severe complications and sometimes death. Now, many pregnant women in Africa now abort their pregnancies as they don't have the means to cater for their own health or the child's. That's how bad it has been. Now, for a country like Kenya, and I go to Nairobi, where Immaculate is, which for a country like yours, which depends on the US for about 95% of its aid for reproductive and sexual health, what's the reality like at the moment now you've been able to situate it? It looks like even having a conversation or collaboration with other agencies has become nearly impossible.
I think the situation as it is it's very red all over the world. It is still the same case in our country, Kenya. However, I think as a country, we realized that this was going to greatly affect us as a nation. And the partners who were greatly affected ensured that the remaining partners who are still standing strong, we ensure that we work with the county governments, the national governments, to ensure that even us as a country, then we need to set aside resources that really deals with issues of sexual reproductive health. We really need to be self-sustained as a country. Although we cannot say that as a country we can be able to reach that 100% required resources, but we are really advocating as civil society organization to our government to ensure that at least there are resources towards reproductive health, so that as much as we face, issues of financial cut-off can happen at any time, at any moment. But as a country, we need to be self-sustained so that we ensure that there are resources to be able to provide issues of sexual reproductive health care as an integrated service without any sector being affected. But I can confirm to you that the global gag rule really affected us as a country. And as I go back to my earlier point where I say that because most of organizations that were funding even government facilities were doing so with an aim to ensure that the services were integrated. So if your funding is cut off, then even that support that you're giving to the national or the county government health facilities, then it means that they had to be cut off. Then what happens? The county now has to depend on itself. So if you're depending on yourself and you don't have that financial sustainability, then even the provision of the quality of service that you provide to your people not efficient, is not enough, is not at that quality that is expected. So as a country, we felt the pinch of the global gag rule. And as I continue to say, as much as the ban has been lifted, it will take us a process, because we have to understand it. What has been lifted, what has not been lifted, it has to be unpacked. There needs to be a strategy to unpack it, so that as a country, we are able to understand this. Are we able to receive, again, resources from the US government? And if organizations are accepting to receive funding from the US government, what are the limits? Are we receiving, and again, after some 5 years, we are going, or 4 years, we are again going to be gagged? If that is the case, then why don't we become self-sustained as a country? But I must say that it really affected us. The issues of teenage pregnancy went up, maternal mortality were felt in place. Young people were not accessing issues of comprehensive SRH education as it used to be. The campaigns, the community outreaches really reduced. The workforce was reduced because some people became redundant, were sent home because of unemployment. So in totality, it was unwholesome. The environment was affected wholesomely, from the young people, from the service providers who had to go home, from the staff within the NGOs who had to go home, the government, the kind of support that they used to receive from different partners was reduced. It was just a very red picture on the ground.
Tambudzai, maternal mortality is increasing in Western and Central Africa and even Southern Africa, as these foundations now lack access to those funds. Listening to Immaculate, what comes to mind is how, low or inadequate or absent the legislators across African countries, not only in Southern Africa, have been, because speaking as a lawyer, shouldn't this have been something that should concern every African leader to see how they can waddle out of this, so that you don't look like always going cap in hand before some Western countries at the expense of life and fetuses? It sounds absurd. Does it make sense?
Well, the funny thing is that our leaders are always crying about sovereignty and how, this is usually when there is conflict between governments and NGOs, and how the Western world is funding NGOs and affecting their sovereignty. Now, this is a textbook case of breach of sovereignty. I'm saying this because if you look at the global gag rule, with a few exceptions, it doesn't matter that your own national law allows abortion beyond the restrictions in the global gag rule. So in essence, they were saying, as long as you are taking US government funding, your laws don't matter. In other words, your sovereignty doesn't matter. And it's a big issue when our leaders are faced with this. They know this because they work with NGOs that receive US government funding. And they know that the NGOs have had difficulties because of the global gag rule. One case in point is, we know the Maputo Protocol has effectively codified the right to a safe abortion, at least within certain parameters. And therefore, that would mean that the African Union as a whole ought to have fought back or pushed back at the US government to say, fine, we appreciate what you're trying to do, but we also have our own priorities as Africans. We have issues of maternal mortality, and that is why we are saying we are taking measures to reduce numbers of unsafe abortion through law. And what they also need to do is to strengthen the laws. So that, I mean, we know that because the global gag rule has been a flip-floppy thing depending on who's in power, the likelihood is, unless they are able to pass the HER Act that they are trying to do, this global gag rule might come again. 4 years, 5 years, 8 years.
But if you let me jump in, Tambudzai, allow me to jump in. Sorry to butt in here, because you recall that it doesn't look as if African leaders are bothered about this, because perhaps maybe it doesn't directly affect them, knowing full well that from 1984, this rule has been there since the time of Ronald Reagan until President Trump expanded it. So what are those key things that should worry us, especially lawyers like yourself, who is an African, looking at how this sort of, give you the color of some kind of slavery? Because you have actually put your laws down, to be subjugated by the American rule, to the extent that you can't, because you want some to be receiving some aid, you have turned a blind eye to what this is doing to your people.
Yeah, and I think that a pushback is possible. There is an exception that was put in, and that was because of activism in South Africa. We know that South Africa has, if not the most comprehensive, at least one of the most comprehensive laws on abortion. And it would be very difficult for healthcare workers to be able to comply with the law and also comply with the provisions of the global gag rule, because not providing counseling and referral for someone is a breach of the law in South Africa. And so they were able to argue that you are putting us in a very difficult position where we are subject to censuring by the law, we are subject to being sued, all because we are trying to comply. So that was put as advocacy, and ultimately you now have what we would call the affirmative defense, where a healthcare worker, if they can demonstrate that there is a positive obligation in terms of the law for them to counsel and refer for abortion, then they would not be bound by the global gag rule. But this one applies directly to healthcare workers. And we know that those who have been providing this service are not restricted to, the strict four corners of healthcare workers. NGOs, like Maristops, for example, at times might not strictly be classified as healthcare workers. They also need that protection. And that's where the problem is. So as government, as states, I would think that one of the things that we should be working towards is strengthening our laws so that we unequivocally show whoever comes, because it's not only the US. I mean, any person who has economic muscle wants to be able to dictate what happens with their money. We also want to be at a position as Africans where we can say, let's negotiate. Let's negotiate at par. We would tell you that, okay, fine, we understand you, these are your values. But we have also sat down as Africans in our regional bodies and have our own set of values that we have agreed on. And this is where we are. Let's talk at that level. And I think that it is possible to get mutual respect if you insist on it. And that is something that we have not been doing. And that's something that we have to continue to do now.
I like the angle you've brought in there, because there's some possibility for the countries, African countries, to have a pushback on this rule. But again, if you look at it, the extension, which is now on HIV and AIDS, a top disease in Southern Africa. And even creeping into Western Africa and even Eastern Africa. Immaculate, help us here. Will the global gag drive Africa back and rid it of its previous progress made before now?
I think the gag rule was one of a stepping stone that was taking us as a country backward, because having looked at where we have come from, where the African nations have come from in matters pertaining health, access to, for example, universal health, there were very many strides that were made to ensure that even women are able to access services, and the services were ranging from access to family planning, access to HIV and AIDS services, access to immunization services, women being able to attend their full ANC visit. But the global gag rule made it so hard for us to be able to provide these services comprehensively. So it was a component that was driving us backward to where we came from. And for me, I felt that it is, as the US government had put it, it was a sort of a point that was meant to make us go back to where we are rather than progressively moving forward. Because as the gag was extended and as the expansion was able to take place, we realized that even as a country, we had to pull back and just start all over again. That what next then? If the money is not there, how do we do it? How do we strategize? How do we even ensure that as a country we are self-sustained to be able to meet the expected results that is required for us? So for me, I feel that the gag rule really made us to go backwards, because as a country we are now experiencing issues of even unsafe abortion coming on the rise. We are seeing young people not being able to access comprehensive sexuality education as was before. Community engagement, where you take the service to where the hard to reach community is, we had to cut them to a minimal number, or in some areas they were cut off completely. So it was a devastating kind of environment where we are, and I think it will take us some time to be able to pull through the loss that we are able to see as a country.
Okay, we'll take a moment. We'll come back. We'll look at how the continent can wriggle out of this if it can, and of course put us vis-a-vis America that touts itself as a country of liberty, and what this also means for the country. That's when we return. You know, the global gag has seen successive American governments either enact the rule or revoke it. Some have been a little bit silent. Well, the US's two major political parties have shown different standpoints on it. George W. Bush, a Republican, and Donald Trump, also of the same party, enacted the rule. Bill Clinton and Barack Obama repealed it during their tenures. Now, the world and Africa is waiting on Joe Biden to know where it stands as far as the global gag is concerned. Many believe it will be revoked, but the fear is still palpable across the African continent as its continuity portends grave danger to the reproductive and sexual health of women in Africa. Now, you know, increased unsafe abortions, high maternal mortality as a result of the shortage of funds and closure of many clinics have impacted harshly on the continent. Like it is a global gag, it is much more an African gag. Now, my final moment with my guest. Ladies, good to know both of you still here. Thank you so much for your time. Tambudzai and Immaculate. Now, let's look at, do you see the rule being repealed anytime soon? And this is to you, Tambudzai.
Well, the global gag rule has been repealed for now, whilst the Democrats are in charge. We hope for Africa, we probably become democratic supporters, because that means something for us. But it's a bigger deal because it's not just been a pushback against abortion, it's been a pushback against women. It's been a pushback against women's rights. You have had the US taking part in a lot of destructive actions, like supporting anti-women's rights organizations in our continent, sponsoring statements by African governments and others that are very repressive, defunding UNFPA and a lot of other rights-based organizations, fighting against the inclusion of SRHR in any rights discourse. The US under Trump essentially said that there is no right, there is no such thing as, sexual reproductive health rights. But as Immaculate said, as Africa, we have actually progressed quite, significantly on that area, at least on paper. What we needed to do was to then, put the steps to the paper. We have the Maputo Protocol, a very comprehensive and progressive piece of work. If you read Article 14, we have essentially codified sexual reproductive health rights. In order to deal with HIV, in order to deal with maternal mortality, governments are required to put in place measures to ensure that women and young girls are able to access services. They are able to access information. And for us, that is where we are. The Global Gag Rule takes us back. And it's not just the Global Gag Rule. The Global Gag Rule and everything that's associated with it takes us back. And we are hoping that in 4 years' time, we won't have to go back. And it's very, very important because these 4 years that we are likely to have without it aren't enough to undo the damage. Because, how do you resuscitate an organization that has shut down? How do you reintegrate services that have been, desegregated? People have been used to working in silos. How do you remarry HIV with SRHR? Because now it's as if HIV is not a sexual reproductive health issue, but it is. It had to be split, because of that. Now we have COVID. So all of these issues are very, very important, and we need a solution. And maybe perhaps what we need to do as governments, as civil society, is to continue to advocate for a permanent solution, not just for the Democrats to win the elections.
And that's exactly why we're talking about this here on Village Square Africa. Immaculate, listening to Tambudzai, perhaps we should start asking the question, how can NGOs and lawyers like her help draw African leaders to pay more attention to reproductive health of the people?
I think as Africans and our leaders, it's the issue of how can they pay more attention, because I believe with the progress that we have been able to make, they really understand what reproductive health is, and they really understand its components. I think the level has been, we tend to ignore what reproductive health is, and most of our leaders tend to term it as a non-issue. But I think as we move forward, as my colleague had said, that we move forward with advocacy, we ensure that even as we sit on the round table, what are we discussing? What are we putting on the table on issues of reproductive health or health in totality? Because as for example, as African nations, we have been hard hit by the global gag rule. And I'm thinking to my head, what do we do when we get into those international spaces? Do we really be on the forefront on issues of sexual reproductive health? Are we on forefront on issues of integration of services when it comes to SRHR? Or are we the ones as different nations, are we the ones to join the opposition to be able to campaign against this pertinent issue? So at the end of the day, our role as African nations, our role as we work with our leaders is to ensure that even as we get into those spaces, what do we support? Do we really just oppose anything? And if we are opposing, how are we opposing? Because as my colleague had said, that what US did to different organizations was fighting away our sovereignty. Of course, we felt as a nation that we were able to support some organizations that were against issues of ASRH, not thinking that the Gag Rule, when it is expanded, it's going to affect, for example, a nation as for example in Kenya. So for me, my take home should be, as we are advocating, we really need to ensure that we advocate for self-sustainability as nations. We advocate to ensure that our policies are well implemented, and we advocate to ensure that as a nation, then if we have, for example, Kenya has the best of the best policies in place when it comes to issues of sexual reproductive health. We have policies that are really targeted towards ensuring that young people access services. But the question is, do we set aside resources to implement such existing policy? The question is, do we even ensure that these policies are known, are well articulated, for example, with our service provider? So as a country, for me, as a country in Kenya, we need to ensure that those policies are implemented and not on paper. We need to set aside resources, even as we are receiving money from the US government. What do we have on the table as a country? And as my colleague also said, that we need also to be strong on the negotiation table, so that even as the issues come in, then we are able to prove that yes, we have sovereignty and we are able to negotiate as equal partners. And my parting shot would be, yes, Joe Biden has done a tremendous work by lifting the Gag Rule, but the effect won't be felt today, tomorrow, in 1 month time. It can even take a whole year, 2 years, for us to be able to really understand what is it that has been lifted. Is the US government going to ensure that the resources that was being provided before is the same resources that is being brought back? So there needs to be a very clear policy communication so that people can be able to understand what has been lifted, what resources are now available, what is the level of even organizations that are still engaging on issues of abortion. Do they still qualify to apply for those resources? So different steps need to be taken into place. But I must tell you that as much as the lifting is very good, but the results won't be seen today, tomorrow, next month. It can take a year or a year after.
And I'll just take your closing remark from Tambudzai. Listening to Immaculate, one thing that comes to mind is that we're talking about the future of Africa. The very unborn and the women, and this is also important. So how can we drive this home truly before the legislature across the continent, so that they can key into this and ensure that what you're doing now sees the light of day?
We need to continue to advocate for laws that provide protection for women. We need to advocate for recognition of reproductive rights in our constitutions. We need to advocate, as Immaculate says, for resource allocation because a number of our countries have good laws. Kenya has recently had a case in which they were trying to enforce guidelines on access to abortion. And Zimbabwe, for example, and South Africa have codified sexual reproductive health rights in their constitutions. So the groundwork is there.
Okay.
What we need is that we need an attitude change where people go beyond putting things on paper, because we love to be seen as supporting women. That is good when we make the laws that support women, but we also need to partner those laws with actual implementation. We need research. As Immaculate has said, it will take time for us to even see the difference with the dropping of the global gag rule. We are still researching the impact of the global gag rule as of now. We are still seeing it. So we need to accelerate whatever actions that are in place. Governments need to now step up. I know that there are law reform efforts that had stalled, like the Malawi situation that I'm talking about. Because of the global gag rule and its effects, these chilling effects, it was very difficult to continue to advocate. And I would think the government itself would not have been directly affected, but there is always an indirect effect.
Okay.
And that reluctance has to go. We need to accelerate our law reform. We need to accelerate the strengthening of our resources for women and for girls.
Well, certainly this is not the end. We've barely scratched the surface, and global gag rule is a rule that concerns everyone in the world. So Village Square Africa returns tomorrow. Many thanks for joining us, Immaculate and Tambudzai. So you have a blessed night. Watch us live on youtube.com/News Central TV and on Star Times at channels 274. You can also check the latest updates on Africa and on newscentral.africa. See you tomorrow.